All right, I think we are live on Facebook, so we can go ahead and begin. So I will begin the webinar to introduce myself as well as my colleagues, Ashley and Mia, as well as our guest speaker, Jemima. So I am Coach Wanh. I am a coach at AM Opportunities. So in general, your coaches, after your reserve or rotation, we help with the enrollment process. So with collecting documents, helping you find housing, I'm helping you with the visa process if you need help with that. And overall, answering any questions that you might have before you begin your clinical course with AMO or any rotations with AMO. So if you have any questions about the process, please go ahead and ask those in the Q&A section. But like I said, I am Juan. I've been with AMO for about over a year now. So my background, I was on the pre-med track, and I also worked in education as well. So I used to be a medical scribe. I was on the pre-med track, took the MCAT, did pre-med coursework, and I was also working in my college orientation program. And so I loved both the aspects of education and healthcare. So that's where I found AMO, and I really love working here and being able to combine both of those passions. And so I will pass it off to Ashley and Mia to introduce themselves, and then we'll go to Jemima as well.
All right, thanks, Juan. So I'm Ashley. I'm another visitor experience coach here at AMO. I've been with the company about 2.5 years. And, similar to Juan, I just love working with our visitors and helping them be successful in following their dreams and what they want to achieve in the medical field. So I've really enjoyed it, and I look forward to working with many, many visitors. And then I'll go ahead and pass it over to Mia.
Hi, I'm Mia. I recently joined AMO, so I've been with AMO since just February of this year. I'm also a coach, so I rely on Ashley and Juan for lots of tips and tricks as I get oriented to what it's like to be a coach at AMO. And I really was drawn to AMO because I also wanted to kind of be able to play a small part in a medical student's journey in becoming a doctor. So looking forward to continuing that work. And I'll pass it over to Jemima to introduce herself.
Thank you. Hi, I'm Jemima. I'm from Singapore. I did my first 5 years of medicine in China, and I'm doing my entire sixth and final year here in the US. We call it the internship year in Asia. I'm passionate about global health, and I want to go into emergency medicine.
All right, thank you, Jemima. So to begin, I just want to give kind of an overview of what we'll be discussing today. So we're going to be discussing about clinical cores. So what that means is, if you are able to get credit for your medical school through AMO rotations, we can discuss how you may be able to do that. And we'll also, the main focus is going to be on Jemima and her experience and, being able to provide tips to potential future visitors. If you have any questions and you want to do rotations with AMO, this is a great webinar to, answer your questions. So if you have any questions, please feel free to ask those, but we'll go ahead and begin. So Jemima, my first question to you is, can you tell us about your year-long experience with AMO and in Chicago at SAH so far?
So my favorite rotation was obviously emergency medicine. I'm biased. I fell more in love with it after the rotation. You get to see such a variety of patients and do a variety of procedures at St. Anthony. And your role as a doctor varies with every single patient. So you could be seeing psychiatric patients, you could be the primary care physician for a patient, you could see patients with actual emergencies, you could be doing sutures or intubation or helping with intubation. So you never know what your next patient is going to be presenting with, or what procedure you may have to do on them. So there's never a dull moment in the ED at St. Anthony, and time just flies by even on night shifts. All of the other rotations are also very holistic. You get to see the different aspects of every rotation. Like, for example, for neurology, you got to see like inpatient, outpatient, psychiatry, EMGs, EEGs, and participate in them. So my confidence in my medical skills have definitely increased. So when you walk into the room, you talk to the patient. As they're talking to you, observing them, assessing them, doing a physical on them, thinking of the possible differential diagnosis, labs and tests you can run, and treatment you can give. So this sort of thinking is what is ingrained in you by your attendings. And the attendings are very willing to teach and answer questions, and they push you to think like them. So the rotations really build your skills up. Yeah.
Oh, good. Thank you for that answer. And so what made you decide to work with AMO for your course? Do you have, like specific reasons for AMO, or, basically, what drew you to AMO?
Well, so AMO was able to customize my schedule according to the curriculum and the requirements of my university, and at a teaching hospital as well. So plus they don't just help you with the rotations, like you guys help set up everything for the rotations, and during the rotations if we have any issues, and with the necessary paperwork after every rotation. So they're with you throughout the whole process. So they're like a constant support system, and as a non-US IMG, it was very helpful.
Good, sounds good. And just to go off of that, I do want to kind of explain the process to visitors who might be wanting to join rotations. So if you are interested, you can definitely speak to one of our advisors at advisors@amopportunities.org, and they will be able to help, determine if and work with your school to determine if you would be eligible to earn credit for, a rotation with your school. And then once you reserve a rotation, you will be assigned a coach, so either myself, Ashley, or Mia, and we will be able to help with the enrollment process. So any document collection, housing assistance if you need suggestions, visa support if you need help with applying for a visa. So any of those issues or matters, someone at AMO will be able to help you, and we're always happy to help. But to move on, so Jemima, how have your coaches helped you specifically?
My coach was Coach Ashley. She was absolutely wonderful. And she helped me whenever I needed clarification on anything throughout my rotation. As I was saying, as a non-US IMG, you don't have other students from your school rotating with you. So it was very helpful to have her support to clarify things. So yeah, thank you.
Yeah, sounds good. And like we said, we're always happy to help. And so what advice would you give to other students looking to complete their course through AMO?
Well, I would say make sure you plan your timeline early, like really early. Like you can't predict some things, like COVID happened. So plan it really early, do the vaccinations early, and AMO sort of helps you throughout the whole process. So you always have your support system. Check with them regarding any doubts you might have. Give your AMO your detailed, especially if you want to do all your course here, give them your detailed university requirements and curriculum in advance so they can plan and coordinate with the hospital ahead of time. Make sure you're fulfilling your university requirements during your rotation, and the necessary paperwork after. But of course, AMO will be your support system through the whole process. But definitely go for it. They provide all the support you need as a non-US IMG. They're with you before, during, and after your rotation. So
yeah, sounds good. Thank you, Jemima. And so going off of the preparation, what kind of costs, or what are some things that you had to consider when applying for an AMO rotation, and kind of like for housing and travel and things like that?
Some things I did have to consider was the safety of the location that I was going to be living in. So I had some help with determining the location. Living very near to the hospital you're rotating in, you have to consider safety. So it might not always be the best idea. And with regards to cost, plan ahead of time. And if, like, because of COVID restrictions and stuff like that, if need be, check if you need to be there 2 weeks in advance so that you don't have to do the first 2 weeks virtually. So yeah, there's all of that.
Yeah, sounds good. And to kind of go off of that information, so right now with COVID, there might be some travel restrictions. For example, there might be restrictions, visa services might be limited. And so AMO, our coaches will be able to help you with that process. So we've had some visitors who applied for a national interest exception. If you're from one of the countries who are affected by one of the presidential proclamations where you might not be able to travel if you're within a certain region within the past 14 days. AMO can help navigate through that. Visas, same thing. There might be visa services that are limited. And so, we'll be able to help draft a support letter for you to support your request if you do want to apply for, maybe an expedited visa appointment. Or if you, overall, if you have any questions about travel or, COVID testing or quarantine or anything like that, your AMO coaches will be able to help you, navigate through that. So rest assured, we have experience in this, and if things come up, we're here to help. So, so my other question to you, Jemima, is, were there any culture shocks or challenging moments for you, especially as an IMG? Maybe there was something that you didn't expect completing the rotation with AMO. What are some things that maybe you weren't, maybe you didn't consider or like weren't fully prepared for, or culture shock moments, things like that?
Well, there was a lot more drug use than I would have seen back home. So I wasn't prepared to see patients who had just been using drugs or like had previous gunshot wounds. So there was quite a few things that were different, but I felt like it really made you, like, it increased your knowledge a lot. So on how to treat these patients, what you're supposed to think of, all the possible things you should think of, all the organs that could be damaged if a gunshot wound were somewhere, and things like that. So yeah, it does increase your knowledge quite a bit. Although, yeah, culture shock, that's going to happen with any country you go to that isn't your own. So it's always a learning experience more than anything.
Right. And so going back to kind of the application process. So what was the application process like for you when you applied for AMO? So how did you kind of go through that pipeline of speaking with an advisor to speaking with a coach and so on and so forth?
So I first started speaking with an advisor. That's the first person you contact. And then you ask them any questions you have, whether certain things are possible. For example, for a teaching hospital was really important for me. So you check with them whether there are rotations in teaching hospitals available for me, and then for you, whatever requirements you have. After that, you sort of reserve your rotation well in advance, and then AMO walks you through the process of vaccinations, and then visas, interviews, and all of that. And then once you've reserved your slot, your coach contacts you, and then your coach is sort of with you through the vaccination process as well, and then throughout your stay here. So anything the hospital, if you don't want to contact someone in the hospital directly, which you definitely could, but if you wanted additional support, your coach is with you for that as well. So, yep.
Good. And some of our programs do have COVID testing requirements, but as we said, first they'll be listed on the program page if that is required. And also your advisor or AMO coach will be able to help you, determine when you should do that test or if it is required for a specific program, or, if the state in which you're rotating in, if that specific state has testing requirements in addition to the program requirements, we'll be able to help you navigate through that as well. And so I kind of want to discuss about kind of the AMO side of things, since there might be some questions about how we can go about doing clinical cores for students. So Ashley, if I may ask, how can visitors earn school credit with our rotations?
Yeah, so that is a great question. I know Jemima talked a little bit about her process. It, of course, will be different for each visitor. So each school will have their own requirements for cores. The majority of schools that take US federal loan dollars require a direct affiliation agreement between your school and the hospital. So like, for instance, with SAH or whichever hospital that you were going to, but some do not. So Jemima, in her instance, her school did not require a direct affiliation agreement. So that makes things a little bit easier as well. But when you first speak with an AMO advisor, you will want to provide them with the contact information for the administrator at your specific school. You want the administrator that handles the international rotations, and then the AMO team would help you navigate that connection. So we could either reach out to the administrator to make sure that what we have to offer will fulfill those requirements. If there is an affiliation agreement, we'll of course assist with all of that. And then in addition, many different states in the US have rules about which schools can place core clerkship students in their state. So it will depend, kind of state by state and where you're looking to go. But we'll also be able to work that out with your school administrator as well to figure out which hospitals may be a good option and which ones would fit for those requirements. And then based on, the US state rules as well. And then the last piece, which I know we talked a little bit about, is the visa. So finally, you will have to get a visa or obtain a B1 visa if you don't already have it. These visas do have a maximum entry for the US of 6 months. So like in Jemima's case, where she was doing a full year, once you have the B1 visa, what you can do, if you're looking to attend for longer, is you can apply for an extension during your first stay. You don't actually have to leave and re-enter, which we were able to support Jemima with that process as well, providing advice and who to contact and how to do that process. So, we try to make it as easy as possible, but it is definitely, there are a few steps. So like we were saying, you definitely want to get started sooner rather than later if you are planning to do your cores, just because, of course, when we're communicating with schools, it can take some time. Figuring out the requirements, figuring out where you can go. It just takes time. So you want to plan ahead. The first step would be to reach out to an AMO advisor. And then if you can provide us with that contact information for your school, we can go from there.
Good. Thank you, Ashley. And I did see a question came in that kind of asked about some of the logistics. So how does that work with the cost of an AMO rotation versus with the semester cost of the school? So each school is going to be different, and the contracting stuff, the paperwork, we'll figure out with your school, and we'll be able to work with them to determine, if your school might be able to provide or cover some of the costs for you, or what the cost would be for you if there are additional costs. So we'll be able to help you, work out with your school what's needed to be done and what the cost will be. And so, question for Mia, what are the requirements for visitors to be able to attend their course through us?
Yeah, that's a great question. So to be able to attend your course through AMO, be sure that you are talking with your school administrator before you reserve your rotation and obtain any of those necessary forms that need to be filled out by one of our programs. So this could be something like an evaluation form or a preceptor agreement. So make sure that you have all of those forms together and then send that over to the AMO advisor that you've been speaking with, and they'll be able to suggest rotations that kind of meet all of those school requirements. We will take care of pre-checking those documents with the preceptor to make sure that all of those necessary forms can be filled out. And then after that, you are clear to proceed. You can reserve your rotation, and then you'll get assigned a coach. And then again, we'll help you before, during, and after your rotation as well.
Sounds good. Thank you, Mia. And then for Ashley, what specialties and locations are available for cores?
Yeah, so with that, the core clerkship specialties are usually internal medicine, family medicine, general surgery, psychiatry, OB-GYN, and pediatrics. So those are available at our core clerkship sites. If your school includes other specialties in their core clerkships, we can assist you with that as well, because each school is a little bit different for what they might require, outside of those. So where these cores can take place is entirely dependent on your school's state-by-state authorization. So like I was talking about previously, that different states have different rules and regulations for where these can take place. So when we work with you and your school, and that school administrator will determine the locations that are available and put together a specialized package that fits your needs, making sure that it's going to cover the core, the specialties that you're needing, that it works in a state that's accepted, that can host those, and then making sure that it's a teaching hospital and things like that, so that you really get the most out of your experience, and that it's going to meet those requirements for your school.
Okay, sounds good. Thank you, Ashley. And so those were kind of the different specialties that are available. But for Jemima, we know that you did and you really liked the emergency medicine, but were there other specialties that you kind of had exposure to, and what could you expect in those different types of exposure types?
Do you mean in terms of cores?
Yeah, so like different specialties that you might have been exposed to, and what you can expect in those.
Okay, so so my university was a bit different. Like Ashley was saying, our cores include EM, they include infectious disease, and a few other things that may not typically be considered cores. And but in terms of like basic course, like internal medicine, every hospital is also different in how they split it up, split the 12 weeks up. So for me, I got to see all of the inpatient, outpatient, when the patient first gets admitted to the ER, and then how they move along through the whole process through ICU, or if they get discharged. So it was very holistic. It was very holistically IM, ER, and then do you discharge or do you not? And then if you admit, then follow up to inpatient. If inpatient feels like they can't handle it enough and the patient requires ICU, then ICU, or they get discharged. And then there's outpatient, where you just deal with, it's a lot like family medicine, but patients come in with a lot more issues. So that was very holistic, and it was IM. So for surgery, we had a lot of OR, and for OB-GYN, there was outpatient, and then there was inpatient, like labor and delivery, where you get to deliver or assist with delivering babies. And then there's the GYN part of it, where people come in for gynecological checkups and stuff like that. So it varies from rotation to rotation, but you do get to see the thing I liked the most was that every rotation was very holistic. You got to see the entire process and be part of it and participate in procedures. So you learn everything about the specific specialty, and that's really the only way you can decide which one you want to go into, I feel. So.
Yeah, sounds good. I see another question. Once you complete your core rotations, is there an opportunity to do electives? And so for that question, it's up to your school as well. If they authorize you to do an elective outside of a core rotation, you can discuss that with your school, and then one of our advisors will be able to help determine if you would be eligible for that. But in most cases, I do believe that as long as your school gives you a clearance for that, it should be fine. I see a question. I would like to ask if it is possible to undergo a rotation at the hospital / clinic, which is affiliated with the university. My medical college requires this for every student to get credit. Thank you for your answer. So we kind of went over that question. If it is a hospital or clinic affiliated with your university, you can discuss that with an advisor to determine if that will be, if you would be eligible to participate in that rotation, or if there are any affiliated with your university, and we can determine if that is possible. What about online IM/surgery sessions? Is it really beneficial, and does it give you a lot of new practices? So we do have online, which we call virtual programs. And so actually we have had cohorts of students from universities who have participated in online sessions who their school deemed it to be virtual rotations to be participated to obtain credit for their school. And so if your school does allow virtual programs, and we do know right now that with COVID, things are always changing. So eligibility might change from time to time. And so if your school does allow virtual programs, we do have a lot of virtual options available in a variety of specialties. And we've had great reviews for them. So I've had recent visitors who have done virtual programs. They were able to rotate from the comfort of their home, and they were able to earn a strong letter of recommendation and use that to apply for residency in the United States. And they were able to match into their preferred US residency program. And so based on that experience alone, I think it's shown that the virtual programs do carry a lot of value, and are comparable to in-person rotations. So if you are able to do a virtual rotation for your school during credit, a virtual rotation is a great way to do that. You save on certain costs, like you don't have to pay for transportation, you don't have to worry about a visa, housing, things like that, immunizations. And so if you are interested in that, feel free to speak with an advisor, and we'll be able to help with that. And so I have another question. May I approximately know how much it costs for Jemima for the year-long rotation? Jemima, I'm not sure if you're comfortable answering this question, but up to you.
Is it okay if I answer?
I think so, yeah.
Okay, so I did 52 weeks, so that was 52,000. It was $1,000 a week.
And I just wanted to mention with that as well, that it will depend on which program. So like St. Anthony, for example, since it is a teaching hospital, since they were able to offer all of the different specialties, there's a cost associated with that. But if you were looking for a different program, or for a different, hospital, things like that, the cost will vary program to program. So, it may be less or it may be more depending on what the requirements are. So really the best way to get an idea of that cost is going to be to reach out to an AMO advisor, so that once you determine the program, the length of the program, and then what the cost is for that specific location, then you would be able to get a really good idea of what the cost might look like for you. And Jemima, I appreciate you sharing that, just to give an idea of what it costs for St. Anthony, for example.
Yeah, and then I have another question. Will we be able to attend all clinical rotations in one state and one hospital, and how much approximately will that cost? So again, each program, it'll cost, the cost will vary depending on what the program offers. If it's a hospital program, if it's a university program, if it offers hands-on, or if it's an observership, things like that. It'll vary. Cost of living will also vary, depending on where you are. So the cost, that's something that you should discuss with an advisor to see if it'd be possible for you. And you can attend in one state, one hospital. And if you're looking to do a rotation, a core rotation for your school, just make sure that, once again, it's okay with your school, and we'll be able to determine, what might be the best place for you. If you're a domestic student, I do know that some universities require certain rotating in certain states, or So, it all depends on what your circumstance is. So make sure you speak with an advisor. Once again, you can reach out to advisors@amopportunities.org, and we'll be happy to help. I have another question. I am a U.S. citizen and a fifth year medical university preparing for clinicals. How much will the cost be approximately? So like we said, it'll vary based on the program, based on what you want, university program, hospital program, residency site, things like that. It'll all vary, but we can help you determine what the approximate cost will be altogether, and what the program will be for what suits your needs if you speak to an advisor. And back to you, Jemima. What are some overall tips and advice that, after completing all of these weeks with AMO in your rotations, what are some tips or advice that you could give to potential visitors who are looking to do course with AMO?
If you're hoping to do residency here, make sure to look up the organization that is like the governing body of that residency, and participate in any mentorship programs they might have, and if they require some residencies require different things, like for emergency medicine, there's a requirement of SLO, which is a different way of writing the LOR. So make sure you get your letters in that format. So you do a lot of prior research, continue to do research during your residency, during your rotations, so that you can achieve what you want to achieve. If you're just looking to do rotations here to gain US clinical experience just for knowledge, then also make sure and it's for university credit, make sure you get the appropriate signatures, get the appropriate paperwork done. So keep constantly doing what you have to do and researching so that you don't miss out on anything.
Yeah, sounds good. Thank you, Jemima. I see another question that came in. I just want to ask how long in advance I need to apply for clinical rotation, even if it's an online one. So I guess for Jemima, how long in advance did you plan ahead when you were considering course with AMO, and if you remember, what were some of the things that took the longest to prepare for when applying?
I actually can't really remember. I think I may have started like way in advance. I started looking up all of these things maybe a year or two before. So I started way in advance. And then because it takes a long while to ask the advisors if if they have rotations that meet all of your university requirements. So that was very important to me. That's why it took so long. And looking up organizations, finding AMO, and then eventually doing all of that. Vaccinations, after you apply, vaccinations does take a long time because you can't get all the vaccines in one day. So you're gonna have to split that up. Yep. So yeah, it does take quite a while. Always plan way in advance. And you don't see certain things happening, like COVID was totally unforeseen. So plan for delays like that. Yep. Yeah.
Yeah, sounds good. Thank you, Jemima. So to go off of that point, so if you are considering course, I would say reach out to an advisor now, sooner rather than later. And because the process can be, and it can take some time, but we can help determine if the timeline is, doable for you. Let me see if there's any other questions that came up. So Jemima,
question while we were looking through that.
Oh, sorry, go ahead.
No, it's okay. Jemima, could you share what was your favorite part about coming to Chicago specifically? I know we do offer a lot of rotations in this area, so it can be, difficult determining what, what state you want to go to, what city, but did you have anything in Chicago that you really loved, exploring or doing? And I know, of course, it was different with COVID and everything, and you were busy with your course, but was there anything that you loved about Chicago?
I actually really love like the beach by Michigan Lake. So I'm from Singapore. We have a lot of beaches, and it reminds me of home. So that's why, yeah, I love that part. Chicago is beautiful. There's tons of things to see. So there's a lot of things I love here. So yeah.
I do want to go off of that. So AMO does have a photo and blog contest. And so for those potential visitors who might want to rotate with AMO, if, while you're outside of rotation and in your rotation, you can definitely take pictures of you and your preceptor and you of, maybe with other rotators. And also things that you're doing outside of the rotation, like, visiting tourist attractions. And if you send us your photos with a blog post of about 300 words, we will enter you into our photo and blog contest. And the winner gets a Kaplan QBank test prep course, which is available for step 1, step 2, or step 3. So if you are interested in applying for an AMO rotation, we do have that photo and blog contest. If you are looking to apply for the U.S. residency match, and maybe you want some additional free courses for the step exams, we do have that contest available. Or if you don't plan on taking that the US MLE, we also provide a gift card from Amazon. And so, Ashley, did you have any other questions? Maybe like a personal, like coach to visitor question?
Yeah, so Jemima, I just had a question. I know you had told me about a lot of organizations that you were involved in and, more volunteering. And I know you mentioned that just a few minutes ago about, to really get involved and do research on the organizations where you're looking to match. Do you want to talk about like how you found, which organizations you got involved with and which ones you're specifically working with currently?
So for me, like I said, I found the governing, like ASAP and EMRA, they're the ones who sort of like handle emergency medicine here in the US. So then I got into mentorship positions or leadership, I was a mentee, and then leadership positions based on global health work I'd done in the past. I'd done a fellowship with FIMRIC. And I'd done volunteering with the UN. So all of these things, I had the prior global health background. And so I was able to take up a leadership position at the international section in EMRA. So there's a lot of, and I also really like research. So I published a paper through a university program back in school. So it's a lot. I did a lot of things based on what I wanted to do more than it's for a requirement, just because I really liked doing them. I really like research. I really like thinking about things like that. So I would say do things you really enjoy and not just to meet a requirement. Obviously, you do have to meet requirements, and I understand. But if you don't do it with enough passion and drive, you sort of lose motivation along the way.
I see another question here. I'm interested in virtual rotations. I finished university already. How can I do that? So if you are interested in a virtual rotation and you are a medical graduate, you can speak to an advisor to see if you would be eligible. And if so, the virtual rotations, like I said, are very useful. And, if you're planning to apply for the U.S. residency match, visitors have been able to earn strong letters of recommendation from virtual rotations and use that to apply for residency and eventually match. And even if it's not for, if you don't want to apply for the U.S. residency match, I really do believe that the virtual programs are still an enriching experience just to, overall help you gain U.S. clinical experience and gain additional experience in, whatever specialty you're interested in learning in. So whether you're a medical graduate or a medical student, whether you're a student looking to do clinical course or, just a clinical rotation with AMO, you can always speak to our advisor, and an advisor will be able to help determine your eligibility and determine which program might be suitable for you.
Oh, Juan, you got muted.
Sorry there. I see another question. Were you rotating with other students from that hospital's medical school affiliation? So I think this is directed to Jemima. So Jemima, were you rotating with other students from the hospital's medical school affiliation?
Yep, I was rotating with a lot of other medical students, which is really great because you learn a lot of things from them. There are certain diseases that are endemic to certain parts of the US, which you might not know about if you haven't done step 1 or step 2. So you learn a lot of things, and you also, it's a bi-directional thing, and you teach them certain stuff. So it's really great rotating with students. So, and plus, there's always things to discuss when you're with someone else, and if something is if you are like, if you have to like go away for a certain time or something, that you always have someone else with you to help you out and stuff like that. So it was really nice. I did rotate with students from Caribbean schools and also students from Chicago, so, and residents as well. So
Oh, sounds good. And these are also a great opportunity, you know, if you are studying for the USMLE and you're rotating with someone else who might also be studying for the USMLE, you know, maybe on the weekends you could study together, or, you know, just go out and enjoy, you know, have dinner or whatever. It's a great way to make connections and, you know, learn from each other, learn about different backgrounds. It's, you know, connecting with other people who have the same interests as you and, you know, might be studying for the same exam as you. So let's see if there's any other questions that have come in. And if you do have any questions, please feel free to ask those in the chat. So I'm not seeing any other questions come in, but Jemima, did you have any other, you know, final words that you'd like to say, or, you know, wise wisdom that you'd like to provide, or words of wisdom, I mean, you know, other tips or tricks to rotating with, you know, AMO?
I don't think I have anything else to say. I've pretty much said everything, but yeah, the thing I keep reiterating is to plan ahead of time. That's like the most important thing. And always make sure you're doing what you have to do to get yourself to where you want to be. So, yeah.
Sounds good. I see actually another question that came in. Does getting a surgical residency or even rotation always harder than normal? I'm not quite sure what that's asking.
I can kind of take that one, Juan. I think that I might know what they're asking. So for us, like to match into, you know, general surgery and things like that, I would recommend, there are a lot of resources out there on the internet about match rates specifically for IMGs. So it does vary depending on specialty. And of course, it doesn't mean that you won't match. It just means that some specialties, such as like dermatology, has a low match rate for IMGs. Doesn't mean that it's not possible, just that it might be a little more difficult, that you need to do additional things to set yourself apart. I believe like internal medicine and family medicine have some of the highest match rates for IMGs. So there is published data available out there. So I would recommend doing some research into that, so that if you know, have a specific surgery specialty that you would like to see what the outcome, you know, might be, definitely take a look at that. As far as getting into, you know, a rotation, you can select to do any type of rotation you want here with AMO. So we have general surgery rotations. You know, some will have pre-approvals, such as they want to make sure that you have, you know, some previous experience, or that your future career plans include going into surgery and things like that, just because there are a limited number of spots that that physician can host. So things like that. But in general, you can participate in any specialty for rotation that you want. Just I would advise looking into the data that's out there to see what the IMG match rates are for certain specialties. And that might play a role in you determining, you know, what specialties you're interested in.
Just to add on to that, make sure what you've done in the past always reflects your desire to go into that specific residency. So continuously involve yourself in like the surgical governing bodies, activities, any grand rounds they might have, keep learning and make sure you're involved in that and that your like resume reflects that. Any research you could do in that field, etc. Volunteering.
Good. I see another question. For an IMG, how many months of rotation do you need to do for FM? So if this is for school credit, that would need to be discussed with your school to make sure that that meets your school's needs. But if you're a medical graduate and you're not doing this for school credit and you're planning to apply for the U.S. residency match, I do know that the Electronic Residency Application Service, or ERAS, they do allow, or they require a minimum of 3 letters of recommendation, I believe. And so if you are looking to match into FM and you do need, additional rotations, maybe you're looking to earn another letter of recommendation. It'll depend on your circumstance, but if you do need those 3 letters of recommendation, maybe you could do 3 rotations with AMO with 3 different preceptors. And you could, I do want to go with, to go on with the letters of recommendation. I do want to give kind of some more information about those. So if you are looking to earn a letter of recommendation with AMO, the letter of recommendation process is quite easy. It will need to be coordinated by you, but each preceptor that is onboarded with AMO agrees that they would be willing to write a letter of recommendation, and that will be based on merit. So you do still have to earn that, but it's good news for you because each preceptor at AMO has indicated that they would be willing to write a letter of recommendation based on merit. So if you are looking to earn a letter of recommendation, rest assured, whatever rotation you're applying for, you will have the opportunity to earn a letter of recommendation. And so if you are looking to apply for residency, you can use that for that match. If the school requires you to complete your comp exam before rotating internationally and step 1 before U.S. clinical rotation, would that be required for virtual rotations? I would say check with your school on that if your school does require you to complete those requirements. That way, you can make sure that all of those steps before you participate in that rotation are fine and that you will be able to rotate virtually. So once again, that's something that you can discuss with an advisor, and we'll also be able to touch base with your school to make sure that any paperwork or other requirements that you need for your school will be taken care of. Okay, any other questions, Jemima or coaches? No, okay. So we'll give it about another minute for people to ask questions, but if not, we can go ahead and conclude, I believe. So in the meantime, Jemima, thank you so much for taking the time to answer all these questions and providing all of that insight. I think it's very helpful for other people to see and hear about your experiences. And if they are looking to apply for a rotation with AMO and get credit for the school, I think this was some really good information for that. So thank you all so much for joining. So we will go ahead and conclude. Once again, if you have any questions, please reach out to an advisor at advisors@amopportunities.org, and someone will be able to help. And we look forward to having you, and we hope that you reserve with AMO. So thanks again, and have a great day. Bye-bye.